When you're enhancing a facial structure, what are the different options of products that can be used to address that?
Well, I think what you're referring to is at surgery, we know that there's been volume loss in most people. At first, it was thought just to be thinning of the skin, and then we realized that there's fat loss in the upper face, as well as fat gain in the lower face, in the jowl area, which makes the face look square. So we try to restore the volume arrangement that's normally present in a young person by enhancing the cheeks and taking some of the fat away from the jowls. I commonly do that in the office without surgery using filler injections such as Juvederm or Restylane. Most people have heard of them by now. But during surgery procedures, I always enhance the surgical outcome by using fat grafts. We take a little bit of fat from the belly usually and inject it where we want to restore volume that's been lost. Even some of the bone structure has been shown to erode over time, so we know we need to replace volume in the cheek area when patients have reached their 40s, 50s, and up. In terms of actual implants, manufactured implants, silicone implants have been popular for decades. I think they're less commonly used now than we did use them in the past, but they are most commonly used in the chin area for people with small chins. They're generally wonderful. For patients who have an indentation in front of the jowl that accentuates the jowl, pre-jowl implants can be very useful. Some doctors, though not most of us, but some doctors are still using silicone implants in the cheek area called malar implants to augment the cheeks. The problem that I've found, and I think others have found this as well, with cheek implants is that most people's cheeks are not symmetric. One is a little higher than the other, one's a little wider. If you look closely at your face, most people are not perfectly symmetric. And when you put cheek implants in, you can't compensate for that. They sit and accentuate the difference, in my opinion, so that many people go, I love my left cheek, but the right implant just isn't equally positioned. So since that's a problem, I think that's quite common, I've avoided using cheek implants for many years. I like using fat or filler injection. But those are the most commonly used implants.